everyone. Welcome and thank you for joining us today as we continue the Rural Health Awareness Month. Today we will be having our intro to rural health talk. We thought this talk was important to have because we feel like we don't get enough exposure to rural health in the UCT Faculty of Health Science. As RSN, our main goal is to raise awareness about rural health because unfortunately the communities that depend on rural health care are often forgotten and underserviced. Rural health is important to us because a large portion of our country, 19.4 million as of 2019, live in rural areas and rely solely on rural healthcare. Healthcare in the rural areas, however, face a lot of challenges, including shortage of resources, doctors, and other challenges that we hope to touch on during the course of this talk. We felt that one of the best ways to raise awareness to these issues is to teach people what rural health is and what it encompasses. To kick us off this evening, we will be starting with a bunch of trivia questions to get us warmed up. Esinako will read out the questions, and if you have a pen and paper, you can write these answers down.
Hey everyone, so these are the trivia questions. The first one is, how many doctors do you expect to find in a rural clinic? If you're writing down, you should be done right. Okay, the second one is, how many nurses do you expect to find in a rural clinic? Third one, do you think the clinics are open 24/7? The fourth one is, what do you think is the average travel time to get to a clinic in a rural setting? Fifth question is, what do you think is the average waiting time to be seen in a rural clinic? And then the last question, what do you think is the most common mode of transport to get to a rural clinic? Okay, so the purpose of asking these questions is to get you thinking about how different the rural healthcare system is and how different it might be from the healthcare system that you're used to. And we will not be giving you the answers for now, but we will play a video afterwards that's going to answer your questions. This video is from the patients that we interviewed from the rural clinic that I went to in Kunu. And yeah, so hopefully they will provide some insight and you will see then if you got the questions right or wrong. I think you muted. Yeah.
Thank you. Sorry about that. So right now we had put together a couple of questions that we had wanted you to discuss amongst yourselves because we wanted this to be more of an interactive type talk, not just us speaking at you and telling you facts and some facts of which you already know. So we had organized some questions to ask and wanted to do breakout rooms, but that will not be happening. So we are posing, asking these questions and having you either answering them in the chats or unmuting yourself and answering them live to have a more discussion as opposed to us talking to you. So you can decide, as I said, if you want to pose your answers in the chat. I'll read them out loud. Or if you want to raise your hand, unmute yourself, and give us what you think. So the first question is, what is rural health and what does rural health mean to you? Let me read it again. What is rural health and what does rural health mean to you?
Hey, just to start answering. Rural health is quite hard to describe or necessarily define because it's different from different areas around the country. But I think most of us have an idea of what we think rural health looks like clinics and healthcare services in literally rural and remote areas. But it's actually a lot broader than that. It's like even in towns or just disadvantaged areas like townships, that's still rural health. So it's very hard to describe it and give like one sort of definitive answer, as to what rural health is.
Thank you. Oh, were you going to add?
I was thinking about the second part of the question. I was just thinking out loud, sorry.
The second part is, what does rural health mean to you?
Okay, give me a moment.
Does anyone, while Alok is thinking, does anyone else have anything they would like to add on to what she said? If not, then I think I can move on to the second question. Hopefully more answers in the second question. Second question is, why do you think rural health is important? I know I sort of gave a few answers in my introduction, but if you have anything that you'd like to add on to that, please do.
I'll add. So for me, I think rural health is important because I want to help people like me, people who look like me. And a lot of people who look like me are in rural areas. And my grandparents still stay in the rural areas. So I know how difficult it is for them to access healthcare. It's just by luck that in our family we have healthcare professionals, but if they weren't there, then it would be difficult because you have to wake up in the morning, you have to go to the clinic. There's a lot that you have to do. And if you have people like us, so if you have students who are already keen to go into rural areas. It just means that there'll be more services available and people will be able to access healthcare closer to them, you know. So I think that's why it's important to me to be able to help communities that I come from. Yeah.
But sorry, I think you also have something to add. You have your hand raised.
Yes. Can everyone hear me?
Yes, we can. You're a bit scratchy, but yes.
Hello?
Okay, we can't hear you anymore.
Can everyone hear me? Oh,
Yes.
add on that question that it could seem like there's urban health and sorry? Can you hear me better now? Sorry. Hello?
Yes.
Oh, sorry. Yeah, and I think although we see it as like rural health versus urban health, it's just health, but servicing the people who just live in a rural area, and it's just as important as if you weren't living in a rural area. And I think it's more the resources you have and just the luck of the draw, whether you live in that area or not. And we don't question whether people in urban areas are worthy of certain resources. So it's almost unfair that we almost have to have rural health discussions and the importance thereof, because it's a guarantee that people in urban areas have resources. But it's not the same chat for people in rural areas. So I think it's important because everyone deserves healthcare. Everyone deserves access thereof. It must be affordable, it must be appropriate. So people who live in rural areas also deserve the same rights and the same resources. But it's just sad that we don't see it like that because of the way that, you know, the health systems are built up. But that's why it's so important for everyone that's why rural healthcare is so important.
I think, thank you for that, Butlari. I think for myself, my answer is much like both Butlari and Kawe. In the sense that I grew up in an urban area. I didn't grow up around much rural healthcare or township healthcare at that. I grew up with the private clinics, private hospitals, there's private GPs on every corner. And when I said I wanted to be a doctor, I sort of like saw all, as I said, like the GPs on the corners of the streets and everything. And like, I used to hear a lot about how in rural health or in rural hospitals or clinics, there aren't any doctors, like there are too few doctors and, you know, all that sort of things. And it sort of didn't make sense to me because like, on one hand, here there are, as Putlari is saying, like an overflow of doctors, like a GP everywhere. But in rural clinics, you'll find that there's no doctors, or, you know, in hospitals, they're overworked, they're understaffed. So it's sort of that, like, that's why it was, or it is important to me, because when I said I wanted to be a doctor, I wanted to like make a difference. And as Kawa said, help people that look like me. But like where I was living or what I was exposed to, they didn't need as much help as the people who I didn't hear about, the people who whose information I had to go get for myself because I'm not exposed to rural health. Unfortunately, UCT doesn't expose me to rural health. So yeah, that's just for me why rural health is important as well. Third question is, what are your experiences or what might...
Just to add, I wanted to add after Kawikazi because of what she was saying. I also grew up in the rural areas, studied there, and it was such a high, should I say high jump, or like a huge shift, you know, from knowing that kind of healthcare and then coming to UCT and, you know, the hospitals that we're visiting and all, it's just like totally different. And because we're not taught about anything that is surrounding rural health, like it's just so different. It feels like there's no representation. I'm not sure if that's the right word, but just there's no representation, and you end up forgetting how it is like for other people. And I don't know, I feel like RSM gives us that platform to know and to be aware, and to also teach others about rural health the way that we don't really see it in these big cities that we are in. So yeah.
Anissa just typed a message in the chat answering this question as well, saying, with regards to why rural health is important, for me, it's so important to make sure everyone in the population is receiving the care they need, being that they are so easily forgotten, even though the majority of the population is not receiving quality and equal care. Yeah. Thank you for that, Anissa. And thank you, Asinako. The next question is, what are your experiences, or what might you have heard about rural health? Anissa, is your hand raised?
Yeah, it is. As first, it's going to be quite noisy. I suppose I'll start off with answering this question. Obviously, what everybody hears the most is that there's a significant resource like allocation deficit in rural health areas, and that there's lots of issues when it comes to trying to access healthcare, and there's plenty of barriers that are preventing people not to stop from accessing healthcare. So and you hear some really rough stories, especially from like with regards to like the waiting times, and even from urban areas. But a lot of the time it's just exaggerated in rural healthcare because of the extensive resource allocation and misallocation, I suppose, and the fact that like doctors don't go into rural care, and like you find very few doctors that actually do care about rural healthcare, but the ones that do are doing the most. So that's yeah.
Yeah, I can definitely relate to that. Most of the things, as I said, I haven't been exposed much to rural health, but most of the things I have heard have been about the waiting times, how I say people have to come in the morning if they want to be seen, the distances that they have to walk to get to these clinics. Yeah, so thank you for sharing that, Anissa. Does anyone else have anything to add on to what Anissa? Lolwake, I see your hand is raised as well. Lolwake,
Was someone gonna talk? Yeah, my hand was up, but I think someone was gonna say something.
No, I was actually calling you.
Oh, okay. I think with rural health, it's very hard to imagine it. Like, in as much as people can tell you the stories and you can research as much as you want, it's until you're actually exposed to it and you see how bad the situation is, then you can really see it. And I saw it a lot with like classmates when you go to like CHCs and they're like, oh, I didn't know it was this bad, or it was like this, everyone's quite shocked as to how bad it actually is when we've been telling the stories repeatedly. So it's very tricky, which is why I'm glad to be part of like RSN, where you get a lot of exposure to rural health. So personally, I have a lot of exposure. I did Shoko Rural RSN, and now I'm in.
And now you're in? Sorry, Lolwake, I think you've cut a bit there.
She's in George.
Oh, sorry. Not necessarily because I have something against rural health or I'm not exposed to it, but it's like the working conditions are so inhumane for the people who work there. And there aren't posts or job opportunities for a lot of people to apply. So in as much as a lot of people could want to go assist, there isn't much opportunity for people to assist, more as this is like such a government level issue where they should make more posts, and more people should be able to work in rural areas. And there are incentives to work in rural areas, like rural allowance and all of that. But if there's no place or space for you to be in there, it's quite hard, and the working conditions really are just messed up. And you'd find some clinics where it's literally just the sisters running it. It's like 3 sisters running reception. One is doing triage, and then the other one is seeing the patients. And that drains like such a large area. And that's the norm because, one, they can't get a doctor in because doctors are expensive to come in and pay for like 1 day of assisting in the clinic. And it's not like an official thing where they can get a post. And it's really quite a messed up system, honestly.
Yeah.
So yeah, that's my little 2 cents.
Thank you for that. I'm gonna move on to the 4th question now, and that is, what do you think are patients' experiences of rural health, and what do you think are the challenges they face the most? I think Loloake might have touched a bit on that with her experiences just now, but if you have anything else that you want to add, please do.
I'll just add a little bit on that. So I think in terms of patient experiences, it's probably the best of both worlds, where it's either really great or, not non-existent or very, very awful. Because I know in rural health, they focus more on community, and there's less of a barrier between the doctor and the patient. So the health professionals are very community orientated, and they get to know the community much better than we see in urban, and that can really improve one's experience. So you feel more understood and heard, and all those nice type of things, all the things you should feel when you consult a doctor. But sometimes it can be, and most times actually, it's very frustrating because you have to queue in the line for a long time, especially if it's something that's quite small. And, if you were in an urban setting, that would take you 5 minutes max, whereas you have to wait for 5 hours. Or you need to get referred, and that's very expensive because you have to travel to the nearest town for an ultrasound or an echo, and that's really expensive. But now you need to plan where am I going to stay? How am I going to get there? All these type of things that a lot of people in urban don't have to think about. And it's just, I think most of the times it's frustrating because, the services aren't there, or it's those type of things where it's come on, guys. But it also is very rewarding for the patients to experience as well.
Yeah. Thank you so much for that, Clary.